What are the tips that doctor can give to our viewers to help to reduce the oily skin?
Frequent washing of the face at least 3 times a day using mild cleansers will help reduce the oiliness of the skin and will reduce the oil secretion. Avoid oil-based cosmetics or comedogenic substances. Avoid excessive cosmetic usage on the scalp and skin. Avoid all cosmetic procedures which will contain so much of oil-based preparations. Eat plenty of vegetables and fruits. Avoid fast foods. Avoid white foods containing maida, sugary drinks, cola, Pepsi, etc. And drink plenty of water and be stress-free in your life. That will decrease the oil secretion.
Okay. So doctor, you talked about the dry skin also. So what are the remedies for the dry skin?
Dry skin usually will have dryness of the whole face, scalp, skin, and especially of the extremities. So dry skin people should use frequent moisturizers. Moisturizers should be applied after each bath. That is, moisture should be there, and that on top of the moisture you have to apply moisturizing lotions or creams. And they have to also eat a lot of nuts, seeds, sunflower seeds, walnuts, peanuts, etc., which will increase the oil production in the body. Frequent washing or frequent bathing can increase the dryness of the skin. So ideally we ask them to avoid frequent washing of the skin. Once a day washing is normal, but excessive washing should be avoided, which will dryness and can cause problems due to dryness like fissuring, chapping, etc.
Are there any soaps for dry skin?
Dry skin persons can use soaps which contain moisturizing agents, or oil-based preparations can be used frequently. But minimal use of soap is advised, because excessive use of soap and water will again increase the dryness of the skin. And you have to avoid sitting in excessive air condition and excessive windy climate, because that even can cause dryness of the skin. In such situations you have to use protective clothing which will cover your skin completely.
Doctor, what about these Ayurvedic oils and all this thing? Like Ayurveda enna ennokke parilla chelappo techu kulikanakke.
Ayurvedic oils does not have any special effect. Only thing is they'll have the oily effect on the skin. But some persons can even have irritant dermatitis because of Ayurvedic preparations. And excessive oils, application of Ayurvedic oils sometimes can produce folliculitis and acne even in some persons.
Hi ma'am, I am Ramya from Amrita School of Arts and Science. How to prevent dandruff?
Dandruff is a normal phenomenon. That is, usually your skin, the superficial layers of the skin will be shed off. But when it is associated with itching, hair loss, and flaking of the skin, that is called as pathological dandruff. That is called as seborrheic dermatitis in medical terminology. And persons with dandruff usually can have dry scalp skin and oily or greasy scalp skin. Those with dry skin on the scalp, they can use oils, and those with greasy skin on the scalp should avoid oil application. And seborrheic dermatitis, it's actually an endogenous eczema. It is exacerbated during summer due to stress, due to application of so many oils or comedogenic substances, due to hair treatments, and in certain diseases there will be increased incidence of seborrheic dermatitis. In such cases you have to evaluate the patient and do relevant blood investigations and then choose the treatment. Otherwise, to prevent dandruff, you have to use minimal oil in dry skin and avoid oil in oily skin. Then every day you have to wash the hair and keep the hair dry. And dandruff and seborrheic dermatitis are usually common in the adolescent age group, that too due to hormonal changes because of excessive oil secretion. And you have to avoid oil-based food, then oily preparations. Can use shampoos, anti-dandruff shampoos, especially medicated shampoos are available which contain ketoconazole and zinc pyrithione, which will reduce the scaling. And because seborrheic dermatitis has a fungal etiology, shampoos containing antifungal agents will take care of the fungus, and that will reduce the scaling of the scalp and itching of the skin of the scalp.
So how often do we have to use that, doctor?
We advise thrice a week application, and you have to apply the shampoo and rinse it for 3 minutes and then wash the scalp hair.
Okay. Doctor, we have heard so many of them saying by sharing the comb.
Because of fungal etiology, when you share combs and even towels, it can cause dandruff.
So doctor, is there a permanent cure for dandruff?
It is prone in eczema patients, and it has a genetic influence, and it is a type of endogenous eczema. It can have recurrence. So you have to take care of your scalp and hair daily to prevent recurrences. And it can exacerbate during CC. It has seasonal variations, and when there is stress, you can have increased exacerbation. So it is a disease with recurrence.